Good afternoon. This is Sharon Beatty talking to you from lovely Keene, New Hampshire. Welcome to the Radically Rural second session. We're going to talk about healthcare. Where do we turn? Healthcare is such an essential service for the sustainability and viability of rural communities. Sometimes it's really hard to find the resources to get all that done. And we have some experts here today who are going to address some of those challenges. There will be an opportunity to ask questions at the end, so please type them in the chat and we'll try to get to as many as we can. I would love to thank Cheshire Medical Center and Don Caruso for their sponsorship of this event for us. They're our local hospital. They're an active part of this community and very important to us. And without them, we would not have been able to put this session on. So thanks to Don and the entire Cheshire Family Medical and Cheshire Medical Center for allowing us to do this afternoon. So my job is to introduce Elisa Drusbaugh, who's the director for the Office of Rural Health and Primary Care in the state of New Hampshire. And I will let her introduce her speakers. But where do we turn to find healthcare in rural communities? Elisa.
Thank you, Sharon. So I am the State Office of Rural Health Director for the state of New Hampshire, as Sharon shared. And what I'd like to make sure you understand is there's one of me in every state. So whatever we go over today, as far as me sharing some experiences from being the director of the office here in New Hampshire, very similar things are happening in every state across the country. I'm just happen to be lucky enough to be here today to talk about that with you. And then when we were putting together the sessions and the panels, I really wanted to make sure there wasn't too much of a New England centric focus. And so I invited two panelists here that are going to give a national perspective. So everything that we share today is available and applicable to every state in the country. And we have a lot of different examples of different kinds of rural and different kinds of rural communities. And so right here, right next to me is Christine Sandy, and she is from the Rural Health Information Hub, which is based out of North Dakota, but is really funded, and their mission is to be this one-stop place for all things rural health related. And that definition really extends way beyond healthcare. And there's a tremendous body of resources available there, but also they are available to reach out to help you find things that you can't find through their hub. They can help you use their Master of Library Science degrees to help you find different things that you need. And I can tell you that I have absolutely given them no notice to help me with presentations for things. And they have turned around research articles and different applicable models for me within days and helped me really build some great content for things that I have participated in. And then all the way over on the other side of the table is Terrell Eisinger, and she's the CEO of the National Organization of State Offices of Rural Health. So that is our member organization as state offices. And so they support us to be viable and helpful resources on a state level, but also really support us having regional connections with each other and national connections, and then also really brokering that relationship with a lot of federal policymakers. And so that allows us to extend our reach and our experience beyond our own state, all the way up to federal level, where hopefully we can tell your stories because we're in those rooms and we can talk about what happens in our communities and what doesn't happen, and offer some real concrete solutions about how we can make sure that the strengths of rural are being represented and that they're being really enhanced by federal policy. What a concept. And that we can also convey from you your stories about how there are barriers or things that get in the way of you really being able to meet the needs of your communities, and to ask for their help to alleviate some of those barriers and to really tell those stories. And that has been a really effective relationship. And she'll tell you more about what they do and what state offices do as well. So I'm going to work the clicker theoretically. All right. So as you well know, the session, this whole track is called healthcare, but we really wanted to talk about healthcare in relationship to health. So I'm going to cover a little bit of that for you. And I apologize if any of this is something you already know or have heard a lot, but we weren't sure exactly who the participants would be. So we didn't want to start off just assuming everybody understood the terminology that we were going to be using. Next slide. Keep going, please. That's my official state logo that I have to use. So this concept, the social determinants of health, is something that has really been talked about a lot in the past few years. It came out of research, and basically it's an attempt to talk about all of the different factors that contribute to an individual's health. And then you can extrapolate and say a family's health, a community's health. And so it's important for me to share with you that healthcare access and quality is clearly very important, but it is not the only thing that impacts people's health. And so there's also education access and quality, the economic stability, social and your community context, and then your neighborhood and your built environment. And I really like this World Health Organization definition on the slide because of the last sentence. So it talks about the general concept around the circumstances, but it also talks about the fact that they are shaped by a wider set of forces, and that's economic, social policies, and politics. And I think sometimes when we see the definition, we don't hear that part. And so I like that because what it tells you is that there's action that can be taken to work on these systems. So if we recognize that there are things missing from some of these areas in our communities, know that you can take action and you can do something about them. And I think that that's really important. One moment, please. So underneath there is a really nice Kaiser Family Foundation chart, which shows, oh, they're not seeing the slides? Oh, I promise it's a really nice chart, but you'll see it. I picked the chart, I'll just tell you that without you having to see the chart, because it gives you some very concrete examples of these concepts.
I think it's also fascinating, Elisa, somewhere I read that 85% of what determines somebody's health happens outside of the clinic.
Yes.
And so that's why what you're talking about is just so critical.
That,
I love
that slide is in there.
Yeah. Oh, okay. I'm sorry.
Yeah, where we talk about the sort of percentage of impact that, that research has shown.
Sorry.
Yeah, no, it's fine.
We're nearly there.
Okay. Can people see that at least?
This is like Star Wars, almost there. Yes, they can see
Okay.
what you're seeing now.
Oh, awesome sauce. Okay, so we're going to skip.
What does that mean?
I'm sure Andrew momentarily, there we go.
All right, there we go. We can go to the next one with the chart. Perfect.
Okay.
So this gives you some concrete examples of the kinds of things that fall under this. For example, when we talk about food and how important food is, that can be anything from being hungry, meaning you're not even getting access to food at all, and then you actually being able to access healthy options. So a difference between being food insecure, or you have the resources to acquire food, but you literally can't find a place nearby that has affordable, healthy options. And the same thing for things like neighborhood and physical environment. It's everything from housing and parks and walkability, all the way down to your zip code and geography. We know through research that place matters. And where you live, even in the same city, can dictate how your quality of life, and really more importantly, how long you live. And that's, I think, really phenomenal when you think about that. That is something that you can be born into, and it can impact your lifespan. And then those are all the health outcomes that really fall into it. So it's everything from your quality of life to how much it costs a system in healthcare, how much it costs you, and what your limitations are. Next slide. I think this is the percentages, because I know I don't have a lot of slides.
I'm always impressed.
Oh, this one I lifted directly from Christine. So this is from RHI Hub, and this is specific rural social determinants of health and opportunities to get into it. So if you don't think of yourself as a health care person or a health person, know that a lot of the work that you probably that drives you, the things that you're passionate about, like Sarah mentioned during the keynote, those goals and things like that, you can find those shared goals in like one of these topic areas and end up finding that you are actually kind of a health person because you care about sexual orientation and gender identity, or you've had an experience, positive or negative, with health literacy. You understand the importance of safe transportation, access, Sometimes that transportation is on your feet. So the fact that you live in an area that doesn't have safe sidewalks or perhaps appropriate places to cycle can be very dangerous. There's a lot of trauma and things that happen in rural communities that could be ameliorated by having safe places for people to enjoy the environment, which is probably the reason you live in that rural community and things like that. So it really is sort of everything across the board and not just that last point, that access to healthcare services. Next slide, please. So I did not put that slide in that talks about it, but so I'll talk about it. So what I know on a good day for the overall health, healthcare can be a 20% impact of your health status. On a bad day, it's about 10%. And so I think when I first found that out, I was really sort of bummed because I'm like, wait, I spend my whole life in healthcare, talking about healthcare, working with healthcare. And I'm like, what am I doing? But I really, I sort of, rustled it around in my brain and I thought about it from a different way. And I thought, this is a huge opportunity because I think that having those relationships with healthcare already, you can help assist them with addressing some of those other social determinants. So even if you are a traditional healthcare provider, you can impact all of those things that we've already talked about. And you probably already know how they impact your community and your patients because they come up. So clinicians know from patient visits when they're having a conversation with someone perhaps about diabetes management, and that person is sharing their inability to access certain services, their inability to participate maybe in chronic disease management strategies, or even to get food that's healthy and appropriate. That all of that comes out, and often the clinician is sort of left with this like basket of stuff, right? That is not what they went to school for, and it is not something that they have an immediate solution for. And so, people in healthcare recognize there's so much more that goes out on that. And I think it can be very daunting to figure out, do we have a place in that? Do we have a place in creating relationships and partnerships to address all of that? And so I was really struck by the radically rural tracks, which I put up here just in case you don't know them all, because I really feel like, it's our first year here as healthcare, but you guys have already been talking about and doing content that really does talk about those social determinants of health. And so culture is important to health, and arts and culture can be really important. And even if it's not a direct sort of art therapy or something like that, having the ability to express yourself or to appreciate beautiful things can be mentally, improve your mental health. And so arts and culture is really important. I think music is really important as part of that as well. People can probably tell you a lot of different coping skills they have that relate to arts and culture. And then journalism, of course, we need people to tell the story of rural. And we need people not to just tell the story of what's bad in rural, like what's wrong in rural, but really about what's great in rural. And so the National Organization of State Offices of Rural Health created National Rural Health Day, and it's in November, and it's called The Power of Rural because we really wanted to focus on that, all of the wonderful things that are happening in rural that could only happen in rural or have really come out of rural. And so the thing about rural that I have noticed working in this field for most of my career now is that it's a great place to innovate. And so there are a lot of things you can do in rural because you have relationships and partnerships that you can't do in larger systems and larger places because there's so many people that you have to communicate with, coordinate, and get on the same page. And so we have found that there are so many things that can happen in rural, not just because of that small space, but because of all of the things that are related to being rural, that community and those relationships and that sort of culture of helping out and really coming at things with a strength-based, what do I bring that is valuable to this conversation, and then really making space for other people to kind of come forward and share what they have. I was really struck by the keynote this morning about how much it really plays into healthcare, and with this conversation today about resources. Next slide. All right, so I'm going to pass it over, and we're going to talk more about collaborations and partnerships.
That wasn't a tech problem. That was just me. I'm Terrell Eisinger with the National Organization of State Offices of Rural Health. But I have to share with you that as the National Organization of State Offices of Rural Health, we're so dependent on our member state offices of rural health. And when we first added pieces about building collaboration with rural communities, Kirby Lacey, who is a State Office of Rural Health Program Coordinator and the Massachusetts State Office of Rural Health, came under our radar screen. And she first came to us in a leadership institute that we offered to community members. And she became our poster child for that leadership institute by her own skills and her own work with rural communities. And she got us thinking about how we think directly, and we learn so much from rural communities. So all of you who have been smart enough to join the Radically Rural conference today, we want to learn from you, and our work in rural communities is so informed, and so we really want you to understand and to honor that. And Kirby started kind of this slide deck that we work on still today many, many years ago, and she received our, that's her with a member from Missouri, and also Karen Madden from New York, and received an award for Emerging Leader. So you start at the community level and you grow that to a national level. Drive the clicker. Next slide, please. So she also is a farmer. And so I think that's such a nice story about where does community collaboration grow from. She runs a small farm called J&K's Good Time Farm. And you can see her in this, I think was a Facebook post or maybe from her website. She has a small farm. She really focuses on sustainability. But what I noticed, these aren't her words, this is what I observe about her. She really is a service to her community. She's all about planting seeds. You will see her post a video about, how to tie a tomato vine, and you'll see her tell the story of the hogs that she's raising and those kinds of things. And what I think about that's so important about that, it's so much like the community development work that we want to do, right? We have to teach people how to shore things up. We have to teach people how to plant a seed. Sometimes we have to spread a little fertilizer when we're doing some of that community work, if you know what I mean. If you've done community work, that's about diplomacy sometimes. But it really is an important thing, and it can bring you such joy and such reward if you can put yourself in the mind of being creative and innovative and service oriented and think about sustainability deeply and make those connections. So the where do we turn answer, next slide please, it's really about turning to community and to partners. Next slide. So I feel bad for the technology people today. It's really very difficult. So at the National Organization of State Offices of Rural Health, as Elisa said, we really focus on our work with communities. Every year, as Elisa said, we do a Power of Rural campaign where we put out, this year we'll be putting out 50 stories of community stars across the nation. I invite you to tell your own story as you're doing that work. We have a community toolkit that allows you to promote your good work and to share your story. And last year on National Rural Health Day, and we invite you to be part of it this year, we earned 68 million impressions on Twitter, if you will. So we're super proud of that. And we think that that is because people want to hear those stories. And certainly, an impression on Twitter happens, and it's also a good lesson in partnership. When a federal agency tweets something, bam, you're going to grow. So if CDC joins with a community star story, joins with the State Office of Rural Health, that multiplies. And that is a story in Where Do We Turn as well. So it's not just about me and my little metrics for National Rural Health Day, but it's really about telling your story. I didn't bring copies of my slides, so now I'm winging it. But Christine is so organized that she did. And so I'm going to go, should I keep talking or would you like me to pause? Pause for one moment. I'm good at that. Thank you, Christine. I do sing in camp and I love to sing in camp. So let's see. They asked me to pause, so I'll pause for a moment. I'm really appreciating my own tech team at home who do not have any kind of technology training or any equipment, and this makes me understand them. Yep. That's good. So I'm going to talk about why partnerships are important. Okay. You can go back one slide too. Christine, you saved my bacon like you always do. It's good to have a partner at a national level and also sitting next door to you in the room.
You're on.
Okay, so I'm going to talk about why partnerships are important. Next slide, please, if you can. There we go. So I love this quote. I really don't know who Mark Hyman is. Maybe somebody else does. But the power of community to create health is far greater than any physician, clinic, or hospital. Now, that does not mean, and just as Elisa said, it's all these pieces of community coming together. But what's so cool, I think, that's happening right now as we're trying to create a new health system and transition to value and know that hospitals are so much more than a place for sick care. They're really transitioning. They need community partners like you. They're really focused and sometimes need to be taught about how to partner with community partners. So I hope that you'll really, if you're a traditional radically rural attendee and you work in arts or you work in transportation, to really think about how you can leverage that partnership with traditional focal points of healthcare in your community, with a federally qualified health center, with a certified rural health clinic, with a critical access hospital. Those folks know health. They know how healthcare works, but they can learn, just like we all can, about how to grow the health in the rural community. Next slide, please. So why are partnerships important? They really are strategically important because resources are scarce, right? There's plenty of work to do and not enough resources to go around. It's the what that we do. We can create a system. It's a little bit different than saying, oh, you have behavioral health, you have clinic, you have emergency system, you have inpatient care, but a system that really takes a look at a patient overall, at the whole. So when we work together in a partnership to look at the community at large, what the community needs, what their perceived wants are, those kinds of things, that can come together to give us that 480 degree of what's needed. And then, how that system comes together is so important. It's a focus on leadership, a focus on community. It's about identifying mutual missions together, mutual benefit, distinct roles, all those things, and thinking about what do you want from a partner. So we really work together. One of the things that NOSOR does a lot of is grant writing training. And honestly, you heard earlier this morning about some of our partners, some of the gal in Colorado was talking about how they live on grants. Federal departments are getting more and more strategic about requiring partnerships. So our foundation. So we'll talk more about that when we talk about funding next time. Again, partnerships should be important to you because they help build your credibility. If you can grow a partnership within your community to address the needs, you have some credibility and some stance as a focal point in your community. It helps make sure that those resources that are so scarce are not duplicated. It's really difficult to take a look at a community, and I've worked with really many rural communities when I was working at a state office of rural health, and I would see that maybe a cooperative extension office was kind of duplicating what a public health nurse might be trying to pull off and working together. Even in the smallest of towns, we can duplicate efforts because we want to meet the needs, and sometimes we get so siloed in our work that if we have strategic partnerships, we can really avoid that duplication. We can save money, for heaven's sakes. We can really ensure the sustainability of a program program by working together, shared resources. It's kind of hard in a rural community to think regionally, but wouldn't it be smart, especially in some of the wide open spaces of our country, if we could regionalize services? If you could really think, is it too hard to do because your football teams compete with each other across the county? Or can you work together to know that there doesn't have to be a mammogram in every hospital or whatever that is? So just, really thinking strategically about what's my niche, what's your niche. That's what we get from partnerships. It builds your knowledge. Folks bring their own expertise, their own data. And again, I said 480 and your 480 perspective on problems and a better reach into the community. If you're wanting to grow the health of a community overall, you have to think about the younger people, the older people, the working class, all of those aspects of the community that usually not one organization can take care of. Health is so much more than, are you sick today? So if we're really going to address health overall, we have to have that comprehensive look. So I'd urge you, as you think about your community partnerships in health, to think across the board and think about what you have to bring offer. I've seen some really bad things happen in partnerships over the years, and I have been the victim of them. And so it makes me very, very careful when I think about partnerships. So it is so not cool to have a partner named maybe in some kind of collaboration that your county is sponsoring or a grant maker, but not really use the assets of that organization. Sometimes at our organizations, because we are national, somebody will come to me and say, well, you give a letter of support. And that will happen to you as a community partner too. But make sure you know what's your piece of that work. So you don't want to be a partner, and you don't want to ask partners to be a partner in name only. Partner is not just, a free source of support and labor. If you're working together, you share the responsibility, but you also share the credit and the funding if that's possible. It's not a scapegoat for when things go wrong. Oh, it's my partner's fault. They didn't get that, that outreach done to that target population. It's no scapegoats. It's not a partner because you're in it together, lifting each other up. It's not a cash cow. You just don't want, don't go to your hospital just for a contribution to a community health initiative. Engage them in this work, and engage your local industry, your mining, your fishing, your logging in that. They want to be more than just a sponsor. Same is true for community foundations. And it's not done internally. If you have a big organization, you can't just partner with yourself. It sounds nice, and but you really have to look outside of your own walls. So all of those things are just so not cool about partnerships. So, that's the what not to do. Next slide, please. So let's talk a little bit about what techniques and how we can go about finding and building partnerships for the good of health in rural communities. Next slide. So when do you do it? You're good? So this is a little corny, but I am a corny person. So when to find partners, you never ever stop. You go and you go and you go like the Energizer Bunny, and it should be part of your work. And I sit there talking to myself saying, yeah, you do that, Terrell. And then, I do my own navel gazing about, oh my God, what's in my work plan that I didn't get done today? But it's all about doing that outreach and staying focused there to achieve those objectives you want. Next slide, please. So when, just know that, especially if you are in arts and culture and you're starting to talk to your local hospital about maybe doing an art installation that would engage the community in identifying their own health and some kind of healing process in the community, you can see that vision for what that art project might do. But maybe that hospital CEO or CFO won't get it right away, right? It's a little bit of a mind shift. So it takes time to build those partnerships. Core partnerships based only on funding are not a best practice. So again, I work a lot in the grant world as well, and the work that I've done with rural communities has been around grants. So it's not about the next grant coming out. It is about a long-term investment in understanding and addressing the needs, health needs of your community. And you don't start from scratch. It's like we happen to be in a church building. You don't really know somebody in your congregation until you get in the kitchen and try to pull off a soup supper, right? I'm bringing some cornbread, you're bringing some soup. Oh my God, where's the dessert? And, where does Mary keep the knives? And, when you're getting in there and chopping it up and making that soup together is when you really learn. So no, that's why it takes a while to build that partnership. It's planting seeds again. What you want to do is really do think like Farmer Kirby just a little bit. Think about having strategic planning conversations. If you're running a nonprofit or you work for a nonprofit, probably once every couple years, somebody says, we're going to work on a strategic plan. Well, guess what? Invite your competitors, maybe. Invite your partners in the community to sit in on at least part of that conversation. Do that strategic planning mutually together. Plan on getting together maybe once a month, once a quarter, sharing information. Hey, did you hear the county's going to do that? Oh my gosh, the museum is going to do an exhibit on this. What could we do to put health in there? And sharing resources, letting each other know. I got a little piece of a grant money that I could fund your art director to come in and help me organize in the community. So again, you're sowing the seeds of that partnership early and ongoing. Next slide, please. Reality check. I already said it takes time. Sometimes you're going to learn a whole new language. For me, I can remember times in my career when I thought I knew what DNR meant. To me, it meant do not resuscitate because I worked in a healthcare environment. And as I was working in a rural community in rural Nevada, I found out maybe that's the Department of Natural Resources to somebody else. So we're talking about different languages. Recognizing that we don't have the same expertise. We bring different things to the table. So my yin and your yang together makes a whole, and we want to acknowledge that expertise. And it takes time to develop that trust and rapport. And again, that's getting in there and doing that work. And then strategizing can sometimes mean the same thing as compromise. If we agree that we're going to work together, sometimes I've got to give. Okay, Christine, you go do that podcast. I was going to do it at NoSOR, but you do it. So those kinds of examples. And you're sharing that space. And I'm only joking because your podcast is going to be wonderful. Next slide, please. But those kinds of things that we give and we get. It's like a family relationship. Where to find partners is part of what I want to just mention to you. I have no idea why Pharrell Williams wrote this, but don't wait for the stars to align. Reach up and arrange them the way that you want. Don't sit and wait for a partnership to come to you. Go after it. Think about what your goals are, what you're going to do. Look within. Who within your organization can connect to somebody else? 9 degrees of separation. We could all work our way to talking, having a personal conversation, maybe with Jimmy Carter if we wanted to. Those kinds of things. So kind of, have to put your mindset a little bit, branching out in your community. I know from living in Winnemucca, Nevada and Elko, Nevada, and coming from family in Scotttown, Ohio, and all those places that we do still compete. So look to your competitors. Who else is trying to serve that? Look to community leaders. Maybe the county commissioners don't give you the time of the day, but look to them. Look to the people of influence and affluence, the business and industry leaders. Look there. And then try to start thinking non-traditionally. What I see in the funding world, in funding opportunities now, it's more like, how are you going to engage a non-traditional audience? The patient population has always been represented on FQHC boards, those kinds of folks, but thinking about how you engage somebody with lived experience, let's say in an opioid substance use disorder issue, it's something for you to really think creatively about and be innovative about to make sure that you're really meeting those needs. So that's so important. Think about where to find partners. Next slide. And, again, you're goal oriented on all this. During the keynote and the introduction, she said, have a purpose. So, my comments are going towards, I'm assuming you got a purpose or you wouldn't be thinking about the partnership, but be strategic. I love this little painting of, how many people are holding up this load that they have to, so really ask yourself, is it really a good fit? Do I really need this many partners? That might be too much. Think about who the ones are that, you just kind of need them to come along with you, maybe on it. And if you've got somebody who's real interested in working with you, but you're not sure you want to work with them, put them on an advisory board somehow, or take a little bit of support. Use them where you can. But again, especially for radically rural participants, really, I think you all are the king and queens of looking beyond healthcare to schools, to libraries, to citizen groups, local governments, all of those kinds of groups that we really want you to make the connection to. So be smart about it. Don't work with people you don't like to be in the kitchen with, would be my voice of experience. Sometimes you meet a group, you think you can smell something on them you don't like. My experience and many years of doing this work is, oh no, that doesn't feel right. I'm going to do something else with that. And I think we've all been there. Next slide, please. Probably you all should be teaching this because you have a lot of lessons to teach us about partnerships. And I'm sure this is work that you do every day. I'm going to talk very quickly about having a possible partner. Let's get that and let's make that work. Make sure that you understand what their perspective are on community needs, that they're relevant to you, that they have a track record they can deliver, that you know what their strengths and weaknesses are. Ask them, where do you think your strength and weakness is? Well, and have those difficult conversations because you're going to be stuck in the kitchen with them or out in the garden trying to pull weeds and they don't see a weed the same as you do. So be very careful about a long-term partner and how they all fit together. It is a marrying up thing. Next slide. So let's talk a little bit about how you put some structure to that. Next slide. Form a consortium. Merriam-Webster's definition is agreement, combination of a group formed to undertake an enterprise beyond our own resources, right? So next slide. Funding sources ask for that. I like this old school three-legged stool. You've got a mutual goal, you've got some time, you've got a commitment, and maybe you have separate roles. Maybe somebody's a fiduciary or a fiscal or a manager. Maybe somebody else actually delivers the education or the art or the transportation or the rides, and somebody else has access. Yeah, those senior citizens, and they're coming here for lunch, and I can give you a senior citizen to get in there and do a neurology assessment. While they're here for lunch, you can do your telehealth, and they can have a walkthrough with one of your neurologists connecting there. So the thing about a partnership, if you're going to get really serious about it, everybody participates and everybody benefits. So when you're thinking about how those resources go, think about it that way. Next slide. So it really is about thinking about how you're going to work together, a governance role, sharing of resources, who makes those decisions, how are you going to handle it when you don't agree about what should be done? Really, you're talking about management, planning, organizing, controlling, leading a group together. And it is a little bit like herding cats. And I would advise, if you can and you're serious, to do some kind of memorandum of understanding. Next slide. And, you're really getting their commitment. You're talking about, do you need confidentiality? Is this something, this is your secret sauce you're cooking? So do you need some confidentiality about your project? And then lay out who, what, when, and how. And then think about what is going to be done is it okay if I text you on the weekends if somebody's not showing up? Should we meet once a week or is quarterly good? Think about your communication in order to have a very successful collaborative effort. Lots of pieces to consider for that. The next slide. And then I really like an MOU. But that's very specific about what the commitments are, what the funding expectations are, who's going to get paid, how we're going to evaluate it, timelines, governance, all of that. It seems like a lot, especially if you're just a small community organization, but I can tell you it does pay off. It'll pay off when you're ready for funders. It'll pay off when you have to, when you're engaging somebody else. It is worth the effort, and you can use a simple little template and keep that partnership vibrant that way. And it won't carry you, but it'll start you off on the right foot. Next slide. And then I love, I just give you a little bit of caution here. I think developing partnerships, yes, it's about farming. It's getting people to sing off the same sheet of music. I like to say, be like Gumby, be flexible in all of your work. And there was a picture there of Maren Aslap. She's the conductor of the Baltimore Symphony Orchestra. And NPR interviewed her, and he asked her, what is your best tool? And she said, it's my face. So it's those expressions that she uses to say, come on, Harry, come in with the cello. Come on, are you going to join in, Fred? And then it's sheer joy when it comes to her. And I'm going to turn things over to Christine.
All right. Thank you. And I'm Christine Sandy, and I'm the program director of the Rural Health Information Hub, and I'm going to be talking about some resources that are available at the national level, primarily the Rural Health Information Hub, which is your first stop for rural health information. We're a national information center for rural health issues, so we cover healthcare as well as social determinants and other things that have a connection to healthcare. All right, and to Terrell's point about partnerships, RHI Hub is operated as a partnership. We are based at the University of North Dakota at the Center for Rural Health, so the primary operations happen there. But we also partner with the NORC Walsh Center for Rural Health Analysis, as well as the Rural Policy Research Institute, or RUPRI. So two great partners who do a lot themselves at the national level. And we're funded by the Federal Office of Rural Health Policy, and that's really important. I don't have a slide about FORHP, but they are located in the Health Resources and Services Administration and are really kind of that key focal point in the federal government for rural health. And they fund things like RHI Hub, like the state offices of rural health. They fund research, they fund community-based grants, as well as doing policy work. So making sure that rural considerations are thought about when new regulations are put into place. So if you're not familiar with FORHP, I'd really encourage you to check them out, to learn about what they do. They are really a key piece of our puzzle in rural health, and making sure that people at the local level do have the resources they need to make decisions, to educate their boards, and to write grants, and on and on. I'll try this one more time. All right, so now a little bit about RHI Hub. So this slide shows our website, and this is really where most of the meat of what we do is. We have a whole team of people who work every day to find resources, to put them on this website for people working across the nation to improve rural health. So ruralhealthinfo.org. If you take one thing away from my part of the presentation, that URL would be it. So the first part of the website that I mentioned is the online library. And as I mentioned, we're out there every day looking for new resources, new news items, events, funding opportunities, um, things that rural communities can use to improve health in their community. So there are thousands of resources and opportunities indexed on the site. And I think that's one of the cool things about working in rural health is that there are a lot of resources available if you know where to find them. And so that's really what we're trying to do, is help people find all of those resources that are out there and available for them. Um, so also on the website, and my, oh, that's good. Okay. It's one of those things I'm worried that it'll click, then advance 12 slides at a time. So also on the website are topic guides, and there are about 50 different topics. So you can see a bit of a variety or examples on the right side of the slide there. So we have things like community vitality and rural healthcare. So looking at kind of that intersection of how rural healthcare contributes to and benefits from the community. Also, important topics like healthcare access and disparities, workforce, which is a perennial issue in rural areas. And so these topic guides give an overview of the topic as it relates to rural health. So what's maybe a little different about transportation in rural areas, or what are special concerns that we have about substance use and misuse in rural areas. Just really kind of giving that sense of what's happening, why it's an issue for rural, and then listing organizations and resources and opportunities directly related to those particular topics as well. And we also have state guides, and our staff work with state offices in all of the states to identify resources at the state level that can help people make connections and find statistics and all of those things that kind of come up on a daily basis, that, gosh, I need a statistics to put in my presentation or my grant, or to somehow make my case for something. So these state guides are intended to give people that kind of jump start and working at the state level. We also have data visualizations on the site, so both static and interactive. The word escaped me for a second there. So we have lots of interactive charts and maps, as well as a data explorer where you can look at the nation as a whole for different indicators, as well as drill down to get county level statistics on many different topics. We also have a section of our site that's called Case Studies and Conversations. And there's a lot in this section, and it's really intended to have those conversations and share those ideas. So we have a publication called the Rural Monitor that we've been doing for almost 20 years. And it features rural stories and rural issues. We also have some videos. We do webinars, Twitter chats. And then we have the Rural Health Models and Innovation section of the site, which I'll talk a little bit more about. We have over 300 project examples, really, in this section of the site. that show successful programs that have been implemented in rural areas. And we share, we connect with those programs and interview folks who've been working with the program to find out things like what did the program do? What were barriers? What would you suggest other communities consider if they want to replicate the program? This section of the site is really about communities learning from other communities and not having to recreate the wheel that somebody has already figured out how to make. We've had some good examples of communities that have been successful in replicating programs out of our models and innovations section. You know, and one thing with this section too is that so oftentimes program models that are shared in the kind of the greater healthcare community are urban based, and they may or may not work in a rural environment, and we don't always know that. So sometimes the models here are communities that have taken those more urban models and implemented them in rural areas. And so they've already done some of that work, and we can learn, you know, what does affect the fidelity of the program. If you don't have an occupational therapist, could a nurse do that work? Some of those sorts of considerations come up when you're implementing model programs. So really learning from other rural communities is key in that. Okay. Keep trying. Yeah. Oh. Okay. So we definitely encourage folks to submit their programs to us for consideration for our models and innovations section. And this slide shows a little bit about what sorts of programs we're mainly interested in. But if you have a successful program and would like to share it, please reach out. So if the program has evidence, so if it has a journal article about it that shows the methodology and that it was successful, and you know, really kind of that research based evaluation, that's one thing that is great. But also we're interested in innovative programs. So, you know, sometimes programs are just maybe too young to really have had that thorough evaluation, but it's a really interesting concept, or it's really seems to be working at the early stages. And so those are things that can be shared. And really, probably more than anything, programs that seem like they'd be replicable in some part in other communities, or that other communities could learn from, even if they don't directly replicate the program, are really useful as well. And then the last one is almost every program model in that section has a contact person who has agreed to have their contact information shared on our website, and are willing to answer questions from people in other rural communities who may be looking at replicating their program model. So that contact is really important for kind of that sharing piece of the models. We also have a tools for success section. that has a variety of different tools in it. One of them is Am I Rural? And that tool lets you type in an address anywhere in the United States, and it comes back with a report that tells you whether that is rural based on various federal definitions of rural. There are a variety. Uh, so it won't be a simple yes or no answer, but it'll tell you for those various definitions if you're rural, as well as whether you have a shortage designation in yours for that particular address. We also have over 20 evidence-based toolkits. So you can see on this slide the different topics that those toolkits cover. But these toolkits are intended to help rural communities think through and implement programs in things like early childhood health promotion and aging in place and oral health. So really just steps through things to consider, different types of program models that can be considered, evaluation and sustainability, all of those things that you really need to think through when you're starting a program. And you can also get updates from RHI Hub through RHI Hub This Week, which is our weekly newsletter that features new things on the RHI Hub website, both our original content as well as things that we found out in the universe about rural health. You can also set up custom alerts and get just what you're interested in, or follow our RSS feeds. And then we also do have a resource and referral service and where you can call or email, and one of our information specialists can help you find whatever it is you're looking for, things like funding or statistics, experts, and research. You know, and I think sometimes the experts piece of that is one of the most valuable things that our staff can help people find, because, you know, so often things may not be easily accessible in terms of information. It might not be written anywhere, but somebody has it in their head. And so it's kind of figuring out who that somebody is and hooking people up with them. And, you know, there are many other organizations working in rural health at the state and national level. The organizations section of our website, which is in the online library, has lists of those organizations. So you can check those out. And I'll just mention a couple. The Rural Health Research Gateway is another website funded by the Federal Office of Rural Health Policy. And that website features all of the research that is conducted by the federally funded rural health research centers. And so a very targeted website, but those research centers do really great work. And I would encourage you to check out the Gateway, both for the publications of those research centers, but also to learn what projects are currently in process at those research centers. And I'd also mention the National Rural Health Association as a key part of the National Rural Health Infrastructure. They are a great resource. They're a membership and advocacy organization. And they have conferences and constituency groups, and really do great work in making sure that people around the nation know what the issues are related to rural health. And they've been doing a lot of work lately related to vaccine confidence and have some great toolkits related to that. A few others, NACHO, the National Association of City and County Health Officials. So these are public health folks, and they represent those local level public health officials. And they do have rural groups within their organization, including a rural emergency preparedness focus. The Community Toolbox is another at the University of Kansas. And they really focus on community development and organizing around that issue, and have a lot of tools available, again, to kind of help folks through that process. The Build Healthy Places Network, and they're not rural specific, but they really have an interest in rural, and they kind of do what their name says. They focus on how do we build healthy places, how do we reduce poverty, and improve the social determinants of health, so that people can live healthy lives. And then also the American Hospital Association just released a task force report on the future of rural health care that I think was really, really valuable. And they talked about things like public-private, payer collaboration to support some of the core rural health needs. And they talked about flexible infrastructure funding, and also some sort of a system to hook grant writers up with communities or facilities that need that service. So they've done great work in that area. And this is my contact information. Feel free to reach out. And I think with that, I'll turn it back to Terrell.
Thanks, Christine. The RHI Hub is really exactly what she said, and so devoted and so dependent on people in rural communities to share their resources. So Christine tried to give you kind of the national perspective on resources at the national level, and now I'm going to put on my CEO hat for the National Organization of State Offices of Rural Health, who are anchors of information and key conveners in rural communities. So we do work to promote the capacity of state offices of rural health and to and stakeholders. We added rural stakeholders to our mission in the last year or so because we're all about improving health in rural America. And it's my privilege to work for the 50 state offices of rural health every single day. Next slide, please. I talked a little bit about the Power of Rural campaign before when I didn't have my slides in front of me. So just a reminder, there's the powerofrural.org website. We're having a great impact to bring attention to collaboration and education and communication and innovation. This year we're focusing on bringing light to the stories around readiness and resiliency, responsiveness, and we want to hear your story. So I hope that you will join us for that. And it is about taking one day out of the year and focusing on the fact that good things are happening in rural places to build rural communities. So there's all kinds of things in that community engagement toolkit. There's coloring books and table tents and all kinds of fun things. So it's a great time if you're not involved in health and you do want to look to a partnership with a health community. Maybe you take that on as Appreciate Your Local Provider Day on National Rural Health Day. So take that and use it. The resources are there. Okay, I'll quit saying next slide. So I'm going to talk about state offices as a state-based resource, and also touch on USDA state offices, academic centers, and policymakers as something for you all to think about. So there's a state office in every state in the nation by design. They are a programmatic anomaly in the federal government. They're funded by the Federal Office of Rural Health Policy, as Christine said, the focal point for rural health in the Department of Health and Human Services. But unlike, I think, any other federal program, for every dollar that a state office of rural health receives in grant money, they have to contribute $3 in non-grant money. money, which means that they're focused on state needs and community needs, and they live on that kind of bleeding edge between their state and their federal government, and all I have to do is look at a Medicaid expansion map and know how tricky and slippery that slope is. They focus around 3 sort of different structures. So most of them, 37 of them, are in a state government, which gives them a great alliance to the state health department. Folks are running community block grant programs around improving health for breast cancer, or working with public health departments. They also function in universities, which give them a great link to workforce and training programs. And there are also nonprofit state offices of rural health to work to leverage and be very entrepreneurial in new programs, like they all do. They're funded for 3 important things: for information dissemination, for collaboration, and for technical assistance. Our last look at numbers showed that they serve about 93,000 clients a year collectively around the nation for technical assistance. And they really are an important resource for you. They're friendly and smart people, like Elisa. Some of them have very small shops, like Elisa, it's a pretty small shop. Some of them are bigger, they're all different. So I can't tell you for every state what they're working on, but what I challenge you to do is to make a connection with your state office of rural health if you haven't already. Find out, I give you 3 talking points on these slides, to learn about what their area of focus is. Those are all 3 general categories. To share information about what you're after, and what your goals are, just like Sarah said in her keynote today. Share your goals, get together, make that connection. And then look for ways to partner with your state offices, in terms of making linkages to other organizations and other resources. They usually will do some kind of a newsletter, email list, maybe even conferences that feature model programs from within their state, or convene you with other important stakeholders. Sometimes they have grant programs. It really is unique and different in every state, but more than likely you'll find a way to plug in. And we're always there to help you if you need some help with making that connection. You can go to our website at nosor.org for a list of them. You can also see their areas of expertise on our website. So really, that's my big thing. Learn about your state office of rural health, get on their list. Their good list. Next slide. Oh, I still have the clicker. What's wrong with me? Top 10 things of what a state office of rural health can do for you. Not every state can do all 10 of these things, but they can help you locate funding. They can leverage. Sometimes they'll hear about more than one place in their state that is looking for resources or trying to build programs, and they can help you get together and leverage your resources. Every state in the nation got CDC funding to address health equity. Many state offices of rural health received what's called a rural carve-out to address health equity in rural communities. And that is a broad scope of work, an important focus of work, the work that probably you are already doing if you're a regular attendee to this summit. So you want to find out about if there's a local point of focus on health equity in the state. Not every state office of rural health is involved in that, but many are, and I'd encourage you to get engaged with that health equity effort. They can really collaborate with you, provide community assistance just to help understand healthcare and healthcare financing needs, those kinds of policy issues, funding, those kinds of things. Education, sometimes they're putting on conferences and webinars to help people understand grant opportunities or changes in state policy. Getting the word out about rural health projects is an important thing that they do. They can also help you find data, especially those that are located in state government. They have a responsibility for disseminating information on data, so I hope that you'll look there. And then we believe that state offices, and part of what our mission is in connecting them, is to tell the stories of innovation. So, you'll get an Elisa Dresba putting, what if that kind of help, that work for innovation. And we see state offices across the country inspiring and sharing stories of innovation. And then supporting health providers and facilities with technical assistance for small critical access hospitals, for rural health clinics, for all they were really counted on during COVID for getting money out to small hospital improvement program kind of hospitals. They've also been very crucial in working with certified rural health clinics. Right now we're the technical assistance provider for rural health clinics and vaccine confidence, and we couldn't do it without the work of state offices of rural health. So get to know them. Those are the kind of top 10 things, and again, they're all different. But I'd also like to encourage you to take a look at other partners who focus on rural health in your state, most likely. Now, they're not going to be all rural. They'll have other functions, but a primary care office, we refer to them as PCOs, have responsibility for designating and updating federal designations of shortage areas. They do needs assessment. They typically are supporting recruitment and retention, and about 2/3 of them somehow work together very closely with the State Office of Rural Health. So, sometimes one of the things that gets in your way to establish maybe a health access point in your state is, are you a shortage area? And a PCO can help you figure that out, and why not, and help you learn more about understanding those. Primary care associations assess and do development and support the growth of primary care access points, typically around federally qualified health centers, but they work across the state in developing primary care. Hospital associations, very focused on supporting the needs of hospitals. Hospitals are the focal point for health in many rural communities, and hospital associations vary in their commitment and their resources for rural communities, but they are typically going to understand the data, the flow of patients, help you understand what are the needs of local hospitals, and may have resources that will help you. State health departments work on public health initiatives and connections to local health departments. So call upon and figure out, and honestly, when I think about collaborating with the state health department, if I'm a community-based person, it's almost kind of, I've used the word almost disease specific or health equity specific. So it's kind of every health department is organized differently. Probably a state office of rural health can help you negotiate that. And then certainly we know that in rural America that we really depend on EMS. Emergency medical services are often volunteer-based in rural places, but we need to make those connections to EMS agencies that might be regulators in the state, but there may be maybe EMS regional offices or other organizations in your state. And it's interesting, it's not just you call, we haul anymore on EMS. So make those connections to support your EMS. We're really seeing so many wonderful examples of community paramedicine, or that ability to go in and help a community respond to community health needs in a different way. You've got a paramedic who's pretty highly trained. How do you take that paramedic who maybe doesn't want to run ambulance, or wants to have a bigger scope of work and really look in community, the health of community? A lot of times they'll start with, kind of frequent flyers and on the ambulance, and they go in and figure out why Mrs. Jones is calling every week because she's fallen, and maybe do an assessment of your home. But the work of community paramedics is much broader than, and probably a whole other class. But make those connections with EMS in your communities and at the state level. And then, always be mindful of, they're not just doing EMS. Emergency medical service agencies and services, local services, are doing a lot of transportation for non-emergent emergencies. Think of ambulances, but I think there was some data released not all that long ago that maybe half of their runs are not emergencies. And what does that mean to your community and that burden on volunteers? So think about that. I also think at the state level, it's important for you to know your USDA director. They're going to be an appointee of the executive branch, that means the president. So they're going to, and they'll roll. When the president changes, those USDA directors will run in and out. But they have They are your gateway to USDA funding and rural development. They have staff that are on board to do community development activities, help you understand what these rural development facility loans and grants are all about. I have seen those guys and gals who do that work show up at a grant writing workshop and say, if you're a small community of, it's 2,000, I'll write that 2-page application for you, because they are really ingrained in their community and so supportive. And they understand financing in a different way than I have ever understood it. You know, I look to see, how do you connect with those USDA community development folks? What kind of professional association might they belong to? They belong to healthcare financing associations, which I think is fascinating. And it's the piece that my little touchy-feely, swarmy, let's partner self doesn't always understand, right? And so they really are a great resource, and they understand federal resources. They're financing experts. They're definitely dedicated to rural, but understand, find out what their priorities are. Sometimes USDA state directors have their own, I'll call it a pot of money, that they've been allocated that they can do special projects with. So you can find your USDA director there. And then it's the same kind of thing. Let them know what your needs are, learn what they do, make a relationship. Academic partners. I mean, academic partners are great for things like telehealth and workforce and all of those things. So I hope that you have some connections to community colleges or universities or medical schools or rural residency programs, and really think about working that academic connection. You know, maybe it's students in your community. Maybe they're doing, you know, some kind of training that they need. So really making that connection to maybe even raise the level of visibility, the prestige of your work, and get attention. I think one of the things that when I worked for the University of Nevada School of Medicine, one of our jobs was to go around and teach and take the medical school faculty out on rural trips. And they would always be blown away by how much they learned in a rural community. They thought they were going there to tell it, and they were there and going there to hear it. And it was fun to be in the van with them after every little stop along the road, and they're like, oh my God, you know, so you really have so much to bring to that. Know that they have competing priorities. If you're working with the School of Social Work and trying to figure out, why can't we get some social work students out here to help, there are lots of guidelines that go along with placing students, and these folks in academic centers have responsibility to maybe gain tenure or write grants or put out papers and lots of other pressures, but you can be a key to one of their answers. And then as you're partnering with them, know that they have costs to cover and indirect costs that they'll carve out of a project for you. So, you know, just learn more about them. You know, there may very well be faculty in public health or medicine or schools of psychology who have students that they want to get out. I once had one of the best partnerships within the university with a medical anthropologist, and she was just brilliant and so dedicated to helping her students learn. So we want that for rural. Policymakers, doesn't really sound like a resource, but stop and think about it. Who is in control of the state laws and the funding for health workforce in your state? Yes, there's federal money coming. Your state legislature is very much influencing licensure, who gets reimbursed, what kind of workforce programs are funded. So make sure that your policymakers know about the needs of your rural communities. I've worked closely off and on over the years with a guy named Charlie Alfaro from New Mexico, who I have a great respect for, and he wrote a guidebook that I don't think got released, but he talked about true program sustainability starts with the recognition that those of us working in rural communities can influence a broader policy environment. That means that we do have the ears of policymakers. We do have the ears of even national policymakers. we need to tell the story about how we're using those funds and the stories of small towns. And Charlie would, when he was teaching people, he'd say, probably the most important question you can ask a policymaker is why not? Why don't those people have access to care? Why aren't they getting grant money? Why not? And that is a persuasive question if you really stop and think about it and how your work relates to health. So that is me talking without my federally funded hat on, actually. So it's really important to make that connection. Locally, I mean, I think that one of the things that we sometimes don't think about when you live in a small town, because I saw this quote one time, and I've lived in small towns off and on over the last 30 years now. I live in the suburbs, but nobody knows the trouble you've seen if you don't live in a small town, right? It's a very common kind of feeling. But what happens to us is locally, we think everybody knows what we do. Yeah, I work at the, we heard someone today, I work at the nursing home. They know that I'm there, but also they don't maybe understand that work. So I loved hearing those stories this morning as I make sure I'm always telling them. And if it's not good stuff, I still share it. So communicating strategically, locally to your connections. I mean, I hope that you're talking to the media, local public health officials, talking to volunteers, funders, bankers, for heaven's sakes. Bankers need to know what you're doing and what your needs are. That question Sarah gave us during the opening is, tell us your goals. All of these are local agencies that I hope that you are making connections with. And I'd love to see on the chat if you have some thoughts about who are your best partners locally and otherwise, and your thoughts about partnerships and resources that are helpful. We'd love to see some of those recommendations. Real hard for us here in this room to know who you are, but we know you know stuff we don't know, and we want to hear your recommendations, your wisdom, and your pearls about that.
So I have a couple of teed up things, but what we really want to do is invite you participating virtually to ask your own questions about maybe, problems that you're seeing, opportunities you're seeing in your communities, and, asking these experts here, and maybe me, what kind of resources or partnerships or things that we know about that exist that have been used to address those similar communities. And so I'll start with one while you guys are thinking and typing. If you type like me, I type with 2 fingers very slowly. First one is around food insecurity. So Christine, many rural families face food insecurity and low availability of both nutritious and affordable provisions. Can you give us an example of a model program that engaged the community to address this issue?
Sure. And I'll use the mic. We, in our models and innovation section on the website, we do have a model called Lakewood Engage, and it's a food access model that is in a rural Minnesota community, and the local health system, Lakewood Health System, determined that we really have a problem with food access, and both in terms of people having enough food, but also do they have healthy food? And so they were able to implement a program that has many different kind of aspects of it to address the different aspects of food insecurity and food access in the community. So things like they always ask at primary care visits, do you have enough food? Are you ever hungry? Kind of questions. And if they identify people who are having trouble accessing food, they have acute care packs. So they have, something right there that they can give to get you through a couple of days until other resources can be identified. And they have a food pharmacy, again, the kind of that prescription food, healthy food idea where they have fresh fruits and vegetables available for folks. Farmers markets, delivering meals to like frozen, like freshly prepared, but frozen meals to people who were maybe just discharged from the hospital. Also, they used that same program for COVID when people needed to isolate in their home and needed meals for that time. So just really, innovative in looking at kind of the whole of what is needed in the community. And one of the neat things about that model, if you look at look at our website and look at that model, is they have a list of partners that's this long. So it's everyone from the local farmer who's growing the food, to people who are preparing those fresh frozen meals, to the electric co-op, and just bringing in a variety of different partners to help with that work, and it has been really successful in their community.
Is there anything in the chat yet?
I'm not seeing anything in the chat, but I have
You are allowed to talk. Oh, I love it. Yes.
So there are a lot of models for big urban things. Can you guys kind of share your experiences with either, and I've seen this once or twice, big organizations like academic centers or big hospital systems that want to try something and they're afraid to do it on a big level, and they will partner with a rural community and let's see if this works on this scale, and then we'll scale it up. Do you have examples of things you've seen like that?
No, the only thing I have that I've seen like that was a big medical center that, it seems strange, but what happens when, a rural community, a rural hospital transferred to a higher level of care in the city, and then when the patients come home, they don't know it. That when the patients come home from the tertiary medical center, and I saw a large hospital system in Nevada employ discharge follow-up. They were building good relations, certainly to feed patients into their system, but she went around and was able to share medical records, examples of what they'd been referred to, and found out she was a former rural hospital CEO, and she'd be able to share with that hospital that they were referred to PT, but there's no PT, or there's no cardiac rehab, and those kinds of things. So I've seen that, but that's been a while. And I think that, when we think of, there was a question earlier this morning about why is it so hard for us to think about hospital mergers and acquisitions and purchase of hospitals. I think people are afraid of that and losing control of their own healthcare. So the more that we can teach urban folks to respond to that, I think that's so critical to our work as rural community leaders. I don't know if anybody else has other examples or not. Do you, Sharon? Yeah.
I have an example that's telehealth based, where we had a few. We only have 13 critical access hospitals in the state of New Hampshire. That means there are 25 beds or less in a rural area. And we had a couple that were really trying to be innovative. It's probably about 15 years ago, to start these telehealth programs where they could try and keep folks in their community by making sure that they had the skill set and that level of care available. And it was very, very difficult for them to sort of sustain and pull off themselves. And so we saw things start and kind of end, and some of it was related to some of the rural maternity issues and things that we've seen as well. But then what happened was later on, all these years blend together for me, but probably 10 years later, we had an academic medical center really launch a program, and they actually accessed a Federal Office of Rural Health Policy grant, and they started this center that was one person in a closet. I kid you not, it was an actual closet. I went there. And they created this idea that their sole purpose was to support the little hospitals, also because they wanted to keep patients at the little hospitals. They're very busy, and they just want to make sure everybody's getting appropriate care. And so they set up this center set up a center and they established this relationship with these little hospitals, and they really tried to program their curriculum around what the little hospitals needed. So what kind of patients are you getting? Where are your providers feeling like they need some support? Can you give us some examples of, people you would have kept if you could have, going through all of that and developing this curriculum. And then also, even if, sometimes it's appropriate to transfer. It's completely appropriate to transfer. How do you make sure that that patient is ready and all of the information is ready and it's all already waiting for the patient when they get to the hospital, so that that transition from one hospital to another is really smooth, and that patient, you're not sending them back through the MRI again, even though they already had one. All of those records have transferred. And so what I have seen is that that little closet has grown into a wing at that academic medical center that I love to tour. It's super fun. They're doing all kinds of things, and not all of it is directed necessarily at rural, but they serve a tremendous amount of rural across both Vermont and New Hampshire. And they've really created this structure that now those little hospitals that wanted to be innovated, they're supported. So it's a lot easier for them to integrate that telespecialty care into their, most of the time, ED, and really get that stroke support, get that risky pregnancy support, trauma, all of that kind of stuff. Really eyes on, really like someone's in a room. And the academic medical center folks tell me that they feel they're standing in the room, they're just another teammate, they're not there to replace anyone, they don't know more than someone else, maybe they've seen a lot more of it, but they stand there, virtually, shoulder to shoulder, walking through, and then just sort of being, when they're called on, they'll give an opinion or talk things over with folks. And we've really seen that launch and sustain, and it's continued to grow. And I think that's a place where it was really mutually beneficial for everyone that's involved in that network.
So okay, it's really hard to keep Sharon Beatty quiet. I admit it. So we only have a few minutes, but I really want to thank all three of these wonderful ladies for visiting us today. They've all given their time and come to Keene and to be part of a brand new thing we've just started this year. But I will tell you that these are ladies who see the resources from the national level looking down at rural. I've been in rural, in the trenches, doing the development work, and sometimes you don't even know what you don't know. And the first thing you have to do is figure out what you need, because you're not even sure. You don't have anything, but what do you need? Both of these ladies have given you resources that will help you figure that out. The Hub and the Offices of Rural Health and the Offices of Primary Care as well, and the National Rural Health Association, they all have people who will help you figure out what do you really need, what can you afford, how are you going to finance it, and they have tools to do this work. So if you're feeling lost, don't give up. Go to your office of your state office of rural health or your state office of primary care, or to the Hub. If you just want to go to their website and hang around, you will find amazing resources that go, oh yeah, we might be able to do that. Because I've been there sitting on the ground going, oh my gosh, we've got all these patients, we've got nobody to see them. They can't get to the big center, 50 or 100 miles down to the road. How do we help these people? There are resources available. You can get help. I encourage you to do it. It doesn't have to be a healthcare activity. It's often a community development activity or a business development activity. If you want to recruit a business to your town, they're not going to come there and bring employees if there's no health care. So you can do it. Trust me. It's been done before by people a lot smarter than I am. But I think it's about time for us to sign off, and I'm not seeing any questions in the chat. So many thanks to all of you for coming. We do have some people out there in webland, and thanks to all these ladies for coming.